Dr. Jeanelle de Gruchy, Director of Public Health for Tameside, and I want to let you know how we're doing in terms of COVID in Tameside. Rates had been steadily decreasing, but unfortunately there's been a recent rise in cases over the last week. So whereas we had up until the 7th of January a rate of 178 per 100,000 residents, in the last 7 days up to the 13th of February, our rate has now gone up to 191 per 100,000. The main COVID in Tameside is now what we call the Kent variant. And the problem with the Kent variant is that it is so much more transmissible than the original COVID. So what that means is that it's really important that we stay at home and only leave the house for essential reasons, such as if you can't work from home and are an essential worker, or you're going to need to help someone who is vulnerable, or do some essential shopping, or your once a day exercise. But always comply with the basic measures. So if you are out, make sure you are wearing a face covering when you need to, that you keep your social distance, and that you wash your hands as much as possible. The good news is that our COVID vaccination program is continuing to progress at quite some speed, and we've now vaccinated nearly 60,000 residents. We're now busy vaccinating the over 65s and adults who are aged between 18 and 65 who are in an at-risk group. And the rapid rollout has also seen every care home resident and staff member offered the vaccine. I'm really keen that no one is left behind. So if there's anyone who falls within these categories who hasn't been vaccinated, then they can still get their jab, and I'd really encourage you to do so. So in order to do that, you can visit the website www.tamesideandglossop.nhsvaccinations.co.uk to book an appointment, or call your GP to book on if you don't have online access. We anticipate that by the end of April, all of those over 50s will have been vaccinated in Tameside and Glossop. Of course, that does depend on getting the supply of vaccine, but that's really good news. When it's your turn to be vaccinated, you will receive an invitation, and I would absolutely encourage you to get yourself vaccinated. While the vaccination is good news, I do want everyone to remember that being vaccinated still means that you can get infected with COVID and you can pass the infection on. If you develop any symptoms of coronavirus, such as a fever, new continuous cough, or loss of or change of taste or smell, you can obtain a test by visiting nhs.uk/coronavirus or calling 111. If your test is positive, you must follow the guidance, including self-isolating immediately for 10 days. And members of your household must also self-isolate for 10 days. If you need support in order to do that, such as food or financial support, please go on our website at www.tameside.gov.uk/coronavirus/self-isolation. Together, we can control COVID. And I do want to thank everyone who's making such an incredible effort to do everything that they can to follow the rules and help keep everyone safe.